Hello, my name is Emma Fuller and I will be presenting the Western Australian Child Development Atlas, Visualising Data on Child Health, Education and Wellbeing. This project brings together data from a range of government sources into one place. It is a resource that maps population-level data of children for different geographic boundaries. The Atlas enables profiles to be created of the development, health and wellbeing of WA children. It can be used to inform the planning and development of policies, services and programs aimed at improving the outcomes of WA children. It has been developed at the Telethon Kids Institute within the Developmental Pathways project and with funding from the philanthropic Ian Potter and Minderoo Foundations and in partnership with government agencies and service providers. This project has been informed by a growing recognition of the importance of place. We know that where people live can influence their health, well-being and development, and it is an important factor in policy development and service planning. The main purpose of the Atlas is to improve the outcomes of WA children. It is an action-orientated project that enables the profiling of geographic areas to inform planning and development of policies, services and programs. It enables access to geospatial information that is unique and not previously accessible. It is a cross-agency collaboration between the Telethon Kids Institute and the WA Departments of Communities, Education, Health and Police. And it is a consumer-driven project. Communities have expressed a need to access their own data so they can investigate key issues and plan services accordingly. What is the Atlas? It is an online interactive mapping tool that utilises Geographic Information System, GIS technologies. The Atlas has the functionality to allow the user to choose what geographical boundary they would like to map by, and at the moment we have included 5 geographic boundaries. We have Statistical Area 2, which is most closely aligned to suburb, Statistical Area 3, Local Government Areas, Regional Development Commission Areas, and the Health Regions. There are many data sources within the Atlas. We have information about NAPLAN. We have information from health, including midwives, birth, hospital, emergency, mental health and cancer information. We also have AEDC, we have service information, and we also have some information about crime statistics and census data. The Atlas also includes service information, so health service data including child and adolescent mental health services, child development services, drug and alcohol services, and early childhood education centres. And we have also mapped service locations onto the Atlas. So all schools within Western Australia, government, non-government and Kindy-Link. We have hospitals, police stations, airports, libraries, playgroups and swimming pools. And we have also put Aboriginal community location points into the Atlas. These are the indicators that we have included in the Atlas so far. We began with 24 and we now have over 100. They have been selected to reflect what is important to governments, service providers and the funders of services, researchers, as well as the broader community. They are currently mostly health and social related with some early education indicators from the Australian Early Development Census. These indicators will be continually refined and added to in order to increase the range of information available in the Atlas. The intention is to provide an overall indication of health-related or developmental outcomes for children and young people in each geographic area. The age range of the indicators includes 0 to 24-year-olds. We have undertaken a variety of measures to ensure privacy protection, and we have addressed the 5 safes. They are a set of 5 principle-driven criteria that must be applied and satisfied before an agency can share information with another party. All data aggregated and de-identified with suppression rules applied for low counts. It is not possible to identify an individual in any of the maps. Children living in the same area have been grouped together and small populations aren't shown or neighbouring areas are combined to increase population size. We have obtained some freely available data sources in the Atlas. We have also applied for data from the WA Data Linkage branch and the WA Police. The project has been approved by the WA Health Ethics Research Committee, and one of the things we have done is build an online login facility to secure access to the Atlas. Consumer consultation has occurred throughout this project. Consumers have seen that there are many benefits to this atlas. It enables access to information that is otherwise hard to obtain. It identifies service need. Policymakers can become more targeted with their decision making. Governments can use their own information to become more effective, and it can also help community groups apply for funding. Consumers have also helped us develop the Atlas by suggesting improvements. The key strengths of the Atlas is that it includes data from the WA government. It is a free online resource. It includes not publicly available data. It has longitudinal information. It has information about the WA population, age distribution and number of families. Services are overlaid. You can download graphs, charts, maps and PDFs, and it is our hope that we will be able to offer analytical assistance as we progress with the project. We also have many requests for use already from local government areas such as Katanning, the Early Years Initiative with Department of Communities. We have services such as Anglicare WA and Nagala and the City of Rockingham are all ready to use the Atlas, and the WA Country Health Service, and we've also had a lot of interest from interstate. What problem will the Atlas solve? Well, it enables free access to multiple data sources in one product. It improves efficiencies. It enables communities to access their own data. It will, when we are able to include it, allow comparison between Aboriginal and non-Aboriginal groups across all indicators and all geographical areas. It is a fluid, responsive product with longitudinal data, and we hope that we'll be able to expand it to include all states and territories of Australia. Okay, so I'm just going to very quickly demonstrate the Atlas. So the first thing you will see is our online login, and you'll create your own access. You will go to a landing page, and here you will see a single map, double map, area profile and population pyramid. Clicking on the single map, just taking a little while to load, you will be able to select your indicator here on the left. So those 100 indicators I mentioned before, those are all the different ones that you can look at. You can overlay services. You can zoom in and out. And go right down into the metro area. So here we're looking at the number of children who attend preschool for 15 hours or more in 2018. You can select an area. Here you can see a time series, bar chart, information about all the different areas, and then there's also information and policy context. Very quickly show you the area profile. So here we have the area profile. We could select Derby, and here we have all of the indicators for Derby in the one place. Going back to our presentation, as the Atlas is further developed, we will be producing a reporting feature that will enable a data snapshot out of a community area to be produced. The potential uses and benefits of the Atlas is that WA government will be able to use it for policy development, evidence-based decision making, service provision evidence and need, hotspotting and trends over time. WA communities will be able to access information and data to develop and implement plans to improve the development and learning of children. They will be able to support communities to create community profiles and present evidence-based policy and program options to communities. Researchers will be able to use the Atlas to complement their programs in the state. They'll be able to get access to a large amount of data to identify potential research questions and topics. They'll be able to provide baseline data to their research projects, and also for grant applications. For more information, you can go to our website or you can email us here. I'd just like to acknowledge the people of WA for the use of their administrative data within the Atlas, our funders, the WA government departments, and the Data Linkage branch and data custodians who have been involved in this project. Thank you very much.